apologize for the darkness. My lighting decided to not want to work with me today. This is the police criminal complaint that we'll be going over. I'm not going to do a word for word. Everything I have will be what's in the complaint. And this complaint is put out November of last year, 2023. And I'll dive right into it. Like I said, this is the police report. So let me play some of Nancy Grace's.
His blood sugar level is lower than the standard range. This is a condition almost always related to diabetes. The patient is not diabetic. Treating doctors believe the only way this patient's blood sugar could have plummeted is if given him a massive dose of insulin. The attending physician is able to get the man stabilized, and he recovers.
Go to a doc, or in our case, we also have a forensic nurse expert. Dr. Kendall Crowns is joining me, Chief Medical Examiner, that's Fort Worth, lecturer, University of Texas Austin, and Texas Christian University Medical School. Dr. Kendall Crowns, what did that reporter just say? I always think of diabetics or blood sugar as the problem would be high blood sugar. I thought low blood sugar is a good thing.
So low blood sugar is a good thing, but critically low blood sugar, where you aren't getting any sugar in your body, your brain thrives on sugar. If your blood sugar goes too low, it causes your brain to short out and you have seizures and it goes to coma and you eventually die.
Also joining us in addition to Dr. Kendall Crowns, Valerie Creel. She has so many letters beside her name. No vowels. RN, BSN, CCRN, forensic nurse expert with the Godoy Medical Forensics, board certified in critical care nursing, and you can find her at godoymedical.net. Valerie Creel, agree or disagree with what Dr. Kendall Crowns just said?
I agree, and I would also like to add that blood sugar, like most labs within the body, are found within a normal range. So anything outside of that normal range would need to be treated once it reaches an extreme value. For example, if a blood sugar reaches lower than 70, a lot of patients would present with symptoms such as shakiness, sweating, symptoms that you get if you would go for a long time without eating. That would also be considered mild hypoglycemia. But once you reach more severe levels, it would need to be reversed with medication, such as dextrose.
Well, the other thing is, I'm going to go to special guest joining us, investigative reporter, New York Post, Deirdre Bardoff. Deirdre, when you're in hospital, you assume that you're surrounded by doctors.
We'll play her off and on throughout the course. So it's like I said, it's not going to be a word for word a reading of the police criminal complaint. We'll be going over Pennsylvania's criteria for the three categories of indictment: the murder, criminal attempted homicide, and the neglect of a care dependent patient or persons, I should say. Then we'll talk a little about her actions that met the requirements for these. We'll go over some of her bizarre text messages, her employment history, and what occurred at each of those places of employment. So we're going to dig really deep into her, because this isn't normal, to have a nurse trying to kill like 19 of her patients. She's an RN. So who basically is Heather Pressdee? On July 26, 2018, she was issued her RN licensure by the state of Pennsylvania. 14 years prior to receiving her RN, she worked as a veterinary technician, and they said specifically providing critical care and anesthesia to various animals. Then in May 24th, 2023, Pressdee was arrested on 38 counts. 2 counts of murder, 17 counts of criminal attempted homicide, and 19 counts of neglect for a care-dependent person. Her license was suspended 2 months after that, July 26, 2023. And mind you, this is like in a 5-year period when she's working. That's all she worked was for 5 years. Could you imagine what she could have, how many patients she would have killed even if she went even longer than that? Oh my. They did do an investigation in one of the facilities because the nurses were complaining that there was a lot of patients dying under her care, and that she was not administering the insulin correctly. Now, I don't know if in your state, how your state does it, but in California, when you take out, it's also like with heparin, when you take insulin out, that there has to be like 2 nurses have to agree upon it and dosage. It can't be just one nurse. I didn't see anything about them going into that, but I just wanted to bring it to your attention. But the nurses went to administration and talked about her improper administration of insulin. And of course, there was an internal investigation and they found nothing. And so, but she ended up quitting anyhow. State of Pennsylvania, they define like criminal attempted murder. It's kind of the same as murder in the first degree. It states that the state of Pennsylvania defines it, okay? The defendant committed an act which constitutes a substantial step towards the commission of a crime. Basically, there is a direct action towards killing another human being with the sole intent to kill them. And that's under the 18 PACS 250-02 Part A. So, according to them, Pressdee met the requirements of criminal attempted murder in that she had the specific intent to kill. She took substantial steps causing the death of patients by administering insulin without medical justification, causing the victim to be placed at risk of death, and causing serious bodily injury. And in some of her patients, I think there were like 2, where she actually injected like air into their IV to create like an air embolism. This woman I'm sorry, this woman is sick. Murder is the second category, and the state of Pennsylvania defines murder as a person who intentionally, knowingly, recklessly, and or negligently causes the death of another human being with the specific intent to kill also. And she satisfied this charge in that she did knowingly and intentionally administer insulin with intent to kill and cause death. Now, when they read her Miranda rights, which I'll get into in a second, she declined, lawyers. She told them all this. She told them everything she did. So she said she knew, and she intended to kill him. The third category is neglect of a care-dependent person. The state of Pennsylvania defines that as acting as a caregiver. The individual did intentionally, knowingly, recklessly, or recklessly cause serious bodily harm and or death by failing to provide treatment, care, goods, or services necessary to preserve the health, the safety, or welfare of a care-dependent person for whom she was responsible to provide care. And she met the criteria because she did know all those things. And when she administered the air embolism and the insulin, she knew what would happen, the outcomes. That is under their law, under Title 18, Section 1. So they already went over hypoglycemia, and, nurses, which I suspect would be here, she knows what hypoglycemia causes, like the fever, sweating, chills, clammy, irritability, lightheadedness, shakiness, nausea, confusion, coordination problems, blurred visions, tingling, numbness, and seizures. It seems like in the hospitals, a lot of the nurses were saying that the patients were seizing and they were foaming at the mouth and stuff like that. That's how they found the patients. Now, when we go over the affidavit part of the let me see if I can bring that up right quick. Okay. Let's see. I think it is 17. Yeah. So in this affidavit, in the affidavit right here, the first 7 points talk about those who investigate the case along with their credentials, that they are who they say they are, and they're equipped to handle and investigate the case. They put Pressdee as having extensive knowledge with insulin due to her mother being diabetic and her having to give insulin to her mother. Plus, as an RN, she's held responsible for knowing about insulin. Basically, her training to treat and identify hypoglycemia leads to her being an expert on insulin, therefore knowing what would result from her actions. So she intended it because she knew what was going to happen. And like I said, when they arrested her on the 24th, 2023, she was to continue to speak with the officers. And she did admit that she administered improper dosage of insulin to the patients on the indictment. Eventually, a family member went to the authorities because of the improper insulin, and also she was being they started investigating her for her abusive behavior towards even staff. So yeah, there's that. Media and her media and digital presence demonstrates also her knowledge of insulin and diabetes. In one of her Facebook posts, I guess, she states, "I know what hypoglycemia looks like." Another Facebook post shows a bottle of insulin with 2 units and another 10, and her stating, "If you need to take 2 units, actually give 10 instead. It could be deadly in a matter of hours." And then her internet searches were like, insulin, can't get that out, sorry. Lilly pharmacological insulin, ICD-10 for diabetes, and how long insulin's good for. So she did all that. Let's go over her cell phone text messages, and then we'll cut back to Nancy Grace and see what she has to say about some of we'll just cut back to her. So we're not just keep on droning on about, keeping it lively, okay? So actually in September of 2018, she threatened a doctor who criticized her practice. Oh wow. April 6th of 2022, her text message said, "Can I kill this man at Taco Bell?" And June 10th, 2022, relating to a resident. If if you get like this, you will get pillow therapy. Actually, that's June 26th. June 10th was I'm gonna murder already. July 5th of 2022, she's gonna die. These are all what she, put. Um, July 21st, Lisa will die today. September 02, this is of 2022, of course. I'm gonna murder my age. Man, she has a thing for killing people. Dang. September 6th, 2022. She was complaining to her mother about a male resident, writing, "I drugged him already, and I don't know how he is going to wake up. Or if he'll wake up, I guess." October 17th, I'm going to kill this bee. We're on the phone, followed by she's going to die. And then November 19th of 2022, I'm going to get fired tonight. If this, what, I don't know what she's replying to, if this, because it has like SIC, says, "Excuse me one more time," because she can't remember my name, she may die. December 7th, while texting about a female resident sleeping, she writes, "She could be dead. She hasn't made a notice since 9, and I'm not checking on her." And then she later writes, "Well, she's alive and she may die now." Okay. Let's just take one more, okay? December 25th, 2022. "I can't with this lady tonight." Followed by, "She's going to get some pillow therapy." Yeah, I can't. I can't get that either. Let's hear from Nancy Grace, and then we'll go into the hospitals that she was working at. Let's see. Okay, let's go to Florida. Let's go this one right here.
a real puzzle. Director of the Center of Advanced Policing and grad program coordinator, Lisa Daddio, thank you for being with us. Listen, I'm not a nurse, I'm not a doctor, but I know this. When you have multiple patients keeling over that are not diabetic of hypoglycemia, including 2 roommates, I would immediately start a homicide investigation.
Absolutely, Nancy. What I don't understand, and here's where it gets a little complicated. Obviously, the facility where these deaths happened would have to have contacted the police department or a family member if they were concerned, but I'm guessing they didn't know the manner or the cause of death at the time that this happened, but the facility definitely knew. So they would have had an obligation to contact authorities. We've gone into facilities like this in the past with a lot less than what happened in this particular case.
Guys, we are talking about a facility, a healthcare facility, including a hospital, where people just die one after the next. And of course, hypoglycemia, low blood sugar, is not contagious. So why are they all dying? And back to Dr. Kendall Crowns, when your sugar goes low, why do you die? And I'm confused about how if you inject insulin into your body, that would make your sugar lower. Explain that.
So basically what happens is insulin is produced by your pancreas naturally to help you process blood sugar. And when you are injected with a lot of insulin, it causes your blood sugar to be improperly injected or decreased or lowered.
Sorry, that was me. So let's go back to there we go. So that kind of breaks things up and get a different perspective on that. So the her first employment was with Encompass Health Rehab Hospital in Hammerville, Pennsylvania. And she was employed as an RN from October 1st, 2018 to April 21st, 2019. Now, in December 7th of 2018, she was counseled due to an error of insulin administration and not following doctor's orders. She was given a verbal warning, and there was a corrective action plan where she had to meet with the nurse educator or the diabetic coordinator at that time. The supervisor stated that she's dosing insulin by herself, so that might go back to what I was saying in California, that they might also have a law there where there has to be 2 RNs to administer the insulin, to have 2 eyes on it. And it's not following doctor's orders when it came to the insulin amount patients received. I think she just guessed, and here you go, you know. The supervisor was concerned that Pressdee was harming patients and took action internally. Co-workers were suspicious of her early on, that she intentionally harmed patients. She was reprimanded for making her own insulin dosage. She was forced to resign, and they were saying no patients died. Yeah, no patients that they know of died. The next hospital was Platinum Ridge Center for Rehab and Healing, which was September 2019 to January 2020. If you notice, she doesn't stay very long in these hospitals, these places that she works in. And she worked as an RN. She was basically fired because she listed a fictitious name of a past coworker as a reference, and the phone number what she used was a family member. Um, they also stated no deaths or injuries were noted that they know of. I'm saying. So I can't even con- co I can't even pronounce it. It's Concordia at Rebecca Residence. I hope I said it right. She worked there on October 30th to 2020 to April 11th, 2021. And she also did list a fictitious name of a past coworker as her reference. So with the patients, they have their initials so they're not, you know, anonymity, And so I'm just going to be using their initials they have and what happened. So at this facility, RE is the patient, 89 years old, and passed away on December 17th, 2020. No diabetes. Pressdee did care for her between December 16th and the 17th. And Pressdee did document giving her pain meds that did not provide her any pain relief. I wonder if I'm just putting out this, so it's just my opinion or my thoughts. I'm not saying she did, but I know there's some nurses that have been caught taking pain medications to patients and giving them sugar water basically. I mean, she wasn't beneath killing patients. Would she have done that too? One wonders. I wonder. Sorry. Don't mean to ramble. She states that she did provide comfort measures to RE, but in the early hours of December 17th, like at 5:55, she found RE with no heartbeat and pronounced RE dead at that time. She did admit to police in the police interview that she gave 120 units of the short-acting insulin. She stated that the patient was not doing well and that was in the hospital and had low pulse ox and was always gasping for air. So Pressdee thought she wasn't doing well and that she just needed to go, I guess. She gave RE 60 units, but when that didn't work, she administered another 60. Aren't you nice? And the patient wasn't even diabetic. I mean, that would have. That's all I have to say. Now, in Bel Air Healthcare and Rehab, or Guardian, she worked there from April 19th, 2021 and to February 28th, 2022. And get this, she worked as an assistant director of nursing. Anyways, her duties were she was in charge, she was the lead, the head person basically. She was in charge of all the nursing staff and administrative tasks to meet federal and state guidelines. She had to address resident concerns, conduct internal investigations, investigate allegations of abuse, handling nursing staff schedule, provide direct patient care when somebody called off. And yeah, at that time, the regional director of operations was concerned that she was killing patients. The faculty administrators were advised that there were a pattern of patients dying under her care. And this is the one when I explained in the beginning that she was being investigated, and they found there was nothing there. This was the place because she did have her license suspended pending the internal investigation. That's when they found there was nothing to support the concerns that she was administering the insulin incorrectly. Of course, we have a couple of decedents at that place. So you have patient SS, a 58-year-old female, and she passed away August 9th, 2021. She was not insulin diabetic. Pressdee did care for her until July 23rd, 2021, and um, stated she was doing well. But then July 24th, Pressdee found her non-responsive. She was admitted to to a hospital for hypoglycemia, but she returned back to Guardian on July 30th, 2021. Then on August 2nd, her blood sugar dropped significantly. It went like 180 to 90 to 45. And so when another nurse provided care for SS, there was no signs of hypoglycemia. So on August 6th, actually, yeah, especially August 9th, Pressdee found her dead. She admitted to the police that she had given SS 60 units of short-acting insulin, and patient was dead 2 hours later. Another nurse found the patient and did call Code Blue. It's interesting because they asked Pressdee why she did it, and she said, yeah, SS looked like an animal with no quality of life. Man, that's cold. That is really cold. And then decedent MB was a 68-year-old female. She passed away September 28, 2021. She was not diabetic, and Pressdee provided direct care on the date of her death. Pressdee states she provided comfort measures. Yeah, we can tell what kind of comfort measures she provided. In the interview, she admitted to giving 100 units of short-acting insulin. The pain med she gave for comfort didn't relieve. That's the second one, isn't it? And she gave her the 100 units of insulin because Pressdee said she was morbidly obese, so it might take more, I guess. And then MB passed away 3 hours later. I'm kind of speechless. I don't know how you guys feel about that, but I mean, why are you in medicine if you don't believe people are, you know, if you don't want to help people? If all you want to do is kill them, I don't know. I'm at a loss for words at her thinking on all this. Then you have another one, decedent JR, a 79-year-old man. He was administered 100 units of insulin, not diabetic. That day, Pressdee had access to the med cart and the med room, so she admitted to it. So another nurse found him dead on November 16th. MC was a 92-year-old female. She passed away on December 28, 2021. And after that, the staff, the nurses, began to question Pressdee's action. I mean, because there was a pattern setting up for them. why are people dying, And MC was non-diabetic. Pressdee sat there, and I don't know if she was lying to the doctor, but she wrote in her notes that the condition of the patient has changed, it's deteriorated, and she called the doctor about it. And then Pressdee it's almost like a pattern that she would say, she'd give them insulin. They were, there was a change in their condition, and, she found them dead, you know. So Pressdee did find the patient unresponsive. What I think is interesting about this patient is OT, occupational therapist, attempted to enter the room. And Pressdee insisted that MC didn't want anyone to touch her that day, and that she was actually physically not letting OT come into the room. She admitted to giving MC 60 milligrams of short-acting insulin also. Patient NH, 88-year-old male, suffered a hypoglycemic incident on February 24th. He, not diabetic. He did pass away at another facility several months later, on December 15th, 2022. On February 24th, he was found non-responsive because his blood sugar was 38. That's the hypoglycemic incident that I was referring to. He went to the hospital, then was released March 11th, 2022, when it was stable, back to Guardian. On February 23rd, Presser did provide care for him. She admitted that she administered 100 units of fast-acting insulin. Now, in this case, a doctor was concerned because this was the second patient he treated from Guardian who'd been under Pressdee's care. And so he made a referral to the Pennsylvania Department of Health at this time about her. So the next place that she worked at was called Quality of Life Services, May 23rd, 2022 to November 2022. And get this, she worked as the assistant director of nursing, and then in July 22nd, interim director of nursing. Her duties included, being the lead, of course, being in charge of the nursing staff, administration, and the task to meet state and federal regulations. She had to address the patient care concerns, conduct internal investigations. How do you investigate yourself? Investigate allegations of abuse, handling nursing staff schedule, and provide direct patient care when someone calls off. So, yeah, there's that. Patient BS was not diabetic. She's a 3-year-old female. She did display symptoms of hypoglycemia on June of 2022. July 17th, she slept for 13 hours. She stated that she felt groggy and unable to move on her own when awakened. She was showing signs of hypoglycemia. Pressdee did admit to injecting insulin, but she said patient must have slept it off. So BS, it does not look like BS succumbed to the insulin hypoglycemic incident. So that's a good thing. Decedent JF 92-year-old male. He was found actively seizing when administered morphine and Ativan. That was, with Nancy Grace's video. Yeah, that, part of what they were talking about. He was who they were referring to. Pressdee worked those hours. Facility asked how he died. Pressdee responded, "No urine output, massive seizure that lasted half an hour." When the cops interviewed her, she admitted to giving 60 units of insulin around the time of him seizing. CK was type 1 diabetic, 51-year-old male. On October 8th, his blood sugar was 43. No, actually, I'm sorry. October 9th. My bad. He was given a glucose gel and his blood sugar started to rise. Pressdee worked those hours. She admitted to giving him 60 units of fast-acting insulin. And it just seems like if you go on and on, it's the same thing, like decedent BM. You have the 99-year-old female, not diabetic. Pressdee worked those days. She found the decedent. No heart rate, no respiration, and was not responding to CPR effectively. She does admit to giving 60 units of short-acting insulin. When questioned, when interrogated, I guess, by the police. So, I mean, it's just basically the same thing, Patient BH, 93-year-old female, non-diabetic, unable to move on her own, inclined to wheelchair. She had dementia. There was no signs of decline due to hypoglycemia, so they were kind of confused. Pressdee did admit to giving her 60 units. The next place she worked was Premier Armstrong Rehab and Nursing Center from November 30th, 2022 to December 31st, and she was a floor nurse. Thanks. A couple of patients died there. LS, 90-year-old female. Pressdee noted changes in her condition and mental status and stated she was non-responsive. She was not diabetic, but it was charted as her blood sugar was charted as being high. And December 8th, she was pronounced dead. Pressdee admitted giving 60 units of short-acting insulin. AS, 85-year-old female, non-insulin dependent diabetic. On December 17th, when she was given insulin at that time, her words were sluggish and she was hard to understand. She went to the hospital. She was transported to the hospital. And Pressdee did work at that time and get admitted to the 60 units. The next hospital was Sunnyview Rehab Nursing Center. January 2023 to May 2023. And she worked as a unit manager on a cardiac unit. Oh my goodness. Her duties were to oversee the LPN and the CNAs on the unit, staffing shortage, and she could provide direct patient care. She had access to med cards and anything she needed to kill a patient, basically. She told a CNA, this section is kind of interesting because you have more of the staff telling you what happened with these patients. She told the CNA that one of the residents just needed to die. The LPN noticed patients were passing away under her care. That others died suspiciously, and the facility did believe Pressdee had something to do with the suspicious deaths. I don't know why they wouldn't call for authorities. I thought that hospitals and doctors were mandatory reporters. So, like, when stuff like this happened, they had to call the agencies to start doing an investigation on that. Let me know if in your part of the woods or where you're at, if they do that. I would be very interested in hearing and seeing that. And then, so ML, 80-year-old female, she was diabetic and in hospice care. Pressdee did provide a direct patient care on the day of her death. Pressdee wrote in her medical records that ML was she provided ML with comfort measures until ML passed away. She admitted to the officers that she did administer 60 units of short-acting insulin. We have just a few more patients. I mean, it's all the same. AV, 104-year-old patient, non-diabetic. Pressdee worked and she did admit to giving 60 units of insulin. Actually, the CNA stated it was actually AV was passing away was unexpected because she was very mobile and she wasn't malnourished at all. But Pressdee called her AV disgusting. And asking when AV is going to die. IS is a 70-year-old female, hospice care for end-stage COPD, but death was unexpected because, like the treatment doctor said, that she was not that sick or malnourished. This is interesting because the daughter came to visit and everything was fine. Then the daughter went to her car for a half an hour. And when she returned, her mother had irregular breathing and all that other stuff. And daughter went and got Pressdee. And after Pressdee, I don't know what Pressdee did, but the patient expired. Pressdee admitted 60 units of insulin and given 60 more because it didn't seem to affect IS. GS, 90-year-old male. He was diabetic actually. It ran high side, not the low side. And Pressdee did take direct care. His blood sugar did drop significantly prior to his death. Now, the LPN stated that she found him foaming at the mouth and only seen this with patients with low blood sugar. The CNA was the one who found he as unresponsive. What happened here, I guess, is the LPN said she went for a break and GS was fine when she went for a break. And then when she came back, GS was dead. And there was she was shocked because there was nothing no signs of decline at all. She admitted to using 10 milliliters of air basically into GS's IV ports, creating an air embolism. And that was only after administering the insulin, because the insulin wasn't doing anything. So, SL, 82-year-old female, non-insulin dependent diabetic. She was supposed to be actually discharged to go home because she was dying from cancer and she wanted to die with family around her. And Pressdee just thought, I guess he was God, that she needed to die. And she stated even to a CNA that SL needed to die. So she administered insulin, and she admitted when the insulin was not effective, she administered 1 syringe of air into her PICC line to create the air embolism. And then SL ceased to breathe. I mean, one more patient. How are you guys? What do you guys think of this? I mean, this is appalling. Anyways, NC, a 43-year-old male. He's diagnosed with anoxic brain injury and various other ailments. He was mobile. On April 30th, 2023, he suffered a hypoglycemic attack, which he went to the hospital for. And she did administer insulin to him, but he was given multiple doses of glycogen, and he was released from the hospital the same day. And then he went back to Sunnyvale, and slowly his condition deteriorated until he passed away. Nurses, he was not checked on by overnight nurses. The day he died, his blood sugar was 23, even though the previous days it was 130. CNA said that Pressdee hated NC and called him a retard. He had a brain injury. Pressdee deemed NC to have no quality of life, therefore didn't deserve to live. Pressdee knew she was killing him when she gave him the insulin. On May 23rd, Pressdee worked at Cheswick Rehab and Wellness Center. She was arrested on the 24th. So, the end of all this. 1 second. What? Okay, it looks like you guys lost it. Let me do the ending for if there's people here. I don't think it's recorded to anything, so I'll probably do if there is people here. And like I said, I cannot determine. I will do I might even do a live stream on my uh do a whole live stream there instead of doing it with Restream, and maybe even go with a different Restream company. Let me just do the end, and then I will finish up, because I'm getting like nothing from anybody, so I'm assuming I don't think anybody's got it. So my ending is the defendant knew and admitted to harming with the intent to kill all patients within the affidavit, spanned 5 years in 11 hospitals. Her criminal conduct exhibited a pattern of behavior. She would work the medical cart, administer insulin during the night shift when staffing was lowest and facilities were quiet. The victims would often remain undiscovered until morning. She often took steps to ensure her victims would expire prior to shift change so they wouldn't be sent to the hospital where her scheme would be discovered through medical testing. If she sensed the victim would pull through, there is a pattern of her taking additional measures to try to kill the victim before they can be sent to the hospital by either second dose or air embolism to ensure death. The evidence and confession demonstrated sufficient probable cause to support insurance of attached criminal complaint. Okay, so thank you. Bye.